Why are CRP and ESR checked in stroke patients? When someone has a stroke, doctors want to understand what might have caused it and how serious it is. Blood tests like CRP and ESR are often part of this process. These tests look for signs of inflammation in the body, which can be linked to many health issues that increase stroke risk. CRP, or C-reactive protein, is made by the liver and rises quickly when there is inflammation or infection. ESR, or erythrocyte sedimentation rate, measures how fast red blood cells settle in a test tube. When inflammation is present, red blood cells settle faster, so a higher ESR indicates inflammation. Checking CRP and ESR helps doctors find if inflammation might be contributing to the stroke. For example, conditions like vasculitis, which is inflammation of blood vessels, can cause strokes and usually show high ESR levels. Infections or autoimmune diseases can also cause inflammation that raises these markers. If inflammation is detected, it can point to underlying causes that need treatment to prevent future strokes. These tests also help assess how severe the stroke might be and what the outlook could be. Studies have shown that higher CRP levels shortly after an ischemic stroke are linked to worse recovery and a higher chance of complications or death within a year. Elevated CRP can reflect more extensive brain injury or ongoing inflammation, giving doctors clues about how the patient might recover. Monitoring CRP and ESR over time is useful too. If these markers decrease with treatment, it suggests that inflammation is going down, which can be a good sign. This ongoing tracking helps doctors decide if the current treatment is working or if adjustments are needed. While CRP and ESR do not directly diagnose stroke or tell exactly what caused it, they add important information. Elevated levels can prompt further testing for issues like clogged arteries, autoimmune problems, or infections that might have played a role. Combining these blood tests with imaging scans and a thorough clinical exam gives a clearer picture of the patient's condition. In summary, checking CRP and ESR in stroke patients is a way to understand the role of inflammation in their health. These tests help identify underlying causes, predict how the patient might do, and guide treatment plans. Always remember, these tests are part of a bigger picture that includes medical history, physical exams, and imaging. If you or someone you know has had a stroke, it's essential to work closely with healthcare professionals to interpret these results and develop the best care plan.